what size is going to be the closest. You want to make sure the whole stoma gets inside the circle, and you'll see that it's about the 2-inch circle seems to be the best size for that stoma. Okay, so you're going to measure. Then the other thing is you're going to have lots of different options for bags. We have a few options here, and you guys can play with these, open them. There's lots of this stuff, so you can mess with it. So different kind of bags. This bag, and you see it's like a Tupperware snap right here on the lid, and it tells you usually somewhere on the box with these bags what size wafer, which is what the wax part is called, is the wafer, what size wafer it needs to attach to. Okay, so this is the one she was showing you. You could use your fingers and get it warm and make it bigger. We're not going to do that with a patient because it's harder with gloves on, and you don't want to do it with your bare skin with your hands. When you're doing it on yourself, that's fine, but on a patient, you don't want to do that. So what you'll do is you will, and every wafer is different, you can cut this. So you know you need a 2-inch opening. So you can take your scissors and cut, and I want you to practice with this. You can cut inside and cut around to make it the size that you need it to be. All right, you are going to peel all the sticky off. Of course, you will have prepped the real patient. You will have prepped, but then we don't have the ring piece. That's an extra little bonus. You're going to put this over top of the stoma and press it down and work the wax and feel how that feels. Okay, and then once you have that on there, you are going to then put your bag on there and start working the Tupperware, and you'll hear, or you'll feel the click of the Tupperware. And just like with your food in the refrigerator, you want to make sure the lid is sealed all the way around. Okay, so you can look at it, you can feel it, you can touch it, and play with it. All right, so that's how that kind of bag works. And I need to get it off. Okay, so you can play with that, you can cut those, play with those. Now the bottom of this bag is open, and this is what she called a drainable bag. Now for a urostomy, it may actually connect to a Foley leg bag. So if you've seen a leg bag, or I'll show you, it's a much smaller bag that people can wear tied like a garter, kind of tied around their leg and be able to empty the urine. Okay, so she says drainable bag. That would be the kind for a urostomy because you're going to have to empty that pretty often. But the colostomy bags can be drainable or not drainable. This is a drainable bag because it's open at the bottom. So the bag, the site, the young lady said she only changes all of that every 3 days because it can irritate your skin, so she doesn't peel all that off. There's also, back here, there is the skin prep wipes that she was using, and none of these are to be used, they're just to look at. Also stoma adhesive paste, which can be used instead of that ring. There's paste that you can put around to help with that seal. So these are just visual things to look at. But anyway, this is an open bag, okay? So when this is on, you have to obviously close it or the stool's gonna run right out. So you have these clips. Now this is very old-fashioned kind, but I know they still exist and a lot of hospitals still use these. Okay, so basically what you're going to do is that when it's on, is you're going to fold the end of it over, and you have to just kind of, I want you to do this because it's a little bit tricky. Okay, you're going to fold it over twice, or maybe 3 times. You don't want to do it too thick because it won't close. And then you need to close the top. I gotta get my tongue just right. Until you hear a click. Okay, so it's hanging here, and you have to roll it around, and you're going to click it shut. So I want you to practice with that because that's kind of tricky. All right, and then to take it off, of course, you would just push this in, open it up, and they can drain the stool out of it. They can disconnect this bag and rinse this bag out. Somebody asked me about reusing ostomy bags. Absolutely, it's an expensive lifestyle. You absolutely can. Patients can absolutely reuse bags. Okay, you rinse them out, clean them, they can put them right back on. Okay. So play with that. This is what she referred to as a closed bag. This doesn't have an opening. This one just snaps onto your Tupperware, and when it's full, you take it off and you throw it away. There may be people that empty these, I don't know. But typically this is a closed bag that gets thrown away. This is my favorite bag. This one has everything all connected. So your wafer, it doesn't disconnect, so there's no Tupperware on this bag. And it's also marked. So when you know you need a 2-inch opening, you can just put your scissors right in here and go to the 2-inch line and cut it. These, you have to just kind of guess. All right, some actually have, so I'm saying there's so many different products and every facility has different kinds. So you put your scissors in here and cut it, right? The patient can use their fingers and if they want to do their own that way. So this is all one piece. This is much more cool and probably much more expensive. So they would just prep the skin, prep the stoma, get it all on there nice and tight, do what they need to do. It's there, all right? The closure of this bag is Velcro. So it peels open, it untwists, and it is also an open, drainable, I believe was the word she used, bag. Again, I want you to play with it. Again, so it can be emptied, it can be rinsed out, okay? But the problem is you can't take it off. So people get real creative in how they clean these, because again, they're expensive. So you might not teach that part to the patient, but they're gonna figure it out because this stuff's expensive. Because this one you can't take off to clean. When it comes off, everything comes off. But I like this because there's no clips. These clips get lost like nobody's business. All right, so this one just literally rolls up and Velcros. Okay, so that's the really cool kind of bag. So I want you to practice with all of these, look at them, play with them. You don't have to stick it onto this ostomy. You can try, but it's that yucky plastic. It's hard to do, but you can try. I want you to measure, the different ones, just some hands-on here with the stoma. So the first time you have an ostomy patient, it's not the first time you've touched this stuff. You're not going to be an expert, but you'll have enough knowledge to be able to start some conversations and teaching. Okay, that's Ostomy Station.